Start Start. Hi, this is Srikanth, who works as a architect engineer in United States in the city of Vancouver, Washington State. This is basically to introduce my friends to the knowledge on cardiopulmonary resuscitation and the practices what are done in the United States of America. Srikanth has been my classmate until 10th class in St. Paul's School, Warangal. Hello Srikanth.
Hey Srinivas, nice to...
Srikanth, can you just tell my friends about how emergency care is taken off, particularly in regard to when someone collapses on road or whenever there is an accident victim, how emergency care is taken care of in the United States of America?
There are a couple of approaches to emergency care. One is calling 911, which is gets you the help from the professionals. 911 is an integrated system. You get help from ambulance services, from fire truck, as well as police, and it's all coordinated. You call one number, you have all of those services available for you. And while you're waiting for the emergency services to arrive, let's say somebody has a MI and needs some help, it takes on average about 4 minutes for emergency personnel to arrive at the scene in US. So those 4 minutes are very critical, and it could mean life or death for the patient, for the person. There are things we know that a bystander, a family member, a co-worker, somebody that's next to the patient can do within those 4 minutes to help the survival rate. And that is CPR. Administering CPR is extremely critical in improving the survival rate.
So when someone has a cardiac arrest or whenever there is a victim of cardiac arrest, other than the hospital, you mean to say that there is a 911 system, like what we have the 108 in India and particularly in our state. They call 911, and whether an accident victim or a victim of a cardiac problem or whatever it is, the ambulance arrives on scene within 4 to 5 minutes.
That's
going to think the same system has to be evolved in our country too?
Sure, and it takes a lot to get there. It's a matter of resources. It's a matter of infrastructure. You need to have vast infrastructure. You need to have good emergency response systems, telecommunication systems, road systems, integration systems between police, fire, and ambulance services. All of those have to be developed. We are making some progress in India in that area over the last couple of decades, but there is still room for improvement there.
Okay. Once the ambulance arrives on scene within 4 to 5 minutes, what do they do? Until the ambulance arrives on scene, suppose it is a road or a mall or an airport or bus stand, whatever it is, some bystanders also would be there. Are lay public also trained in CPR?
A lot of them are, and there are many professionals in US who are required to have CPR training, whether you're working for a government agency or you're working in the healthcare industry or anything like that, you're required to have CPR training. But even besides that, a lot of people that are not involved in that have CPR skills. So that's helpful. That the person that's administering the CPR could be the spouse of the person, could be a friend, or it could be any of these people. And I think the more people that we can bring in to the pool of the trained CPR system, the better the survival rates will be.
So what you mean to say is even the lay public, other than the medical personnel or the paramedics, like the lay public are also trained in CPR. Who gives this training there?
Training is offered in many different areas. There are many independent agencies that offer training. A lot of times they're offered through their employment. Most employers provide this training to their employees on a regular basis, on an annual basis, where they bring in trainers to office to administer that. Fire stations provide this training, hospitals provide this training, so there's a wide network of trainers that are available to provide these skills.
Okay. Now, apart from how frequently are you required to get training in the CPR?
It depends on the agency that you work for. Some agencies require that you get recertified every year. And if you're, let's say if you're in IT you're not really in healthcare industry, so the requirement is not so stringent. But if you're working in a public sector agency, the requirements will be a little more stringent.
So what you mean to say is, in the United States of America, even the lay public, even it is the responsibility of the employer, particularly the organization, to give training to all the employees in cardiopulmonary resuscitation. So God forbid if there is any such instance in the vicinity of the work area, then probably the chance of survival would be very high.
Absolutely, I think this is critical for the wellness of the organization, for the company. They want to make sure that their employees are taken care of, or that, well, if something happens in their office, we spend a lot of time in the office. Practically all of our day is spent at the office. So there's a good chance if something's going to happen, it's going to happen at the office. And also the stress level, we know that contributes to cardiac arrest too. So I think it's extremely important that employers and also commercial establishments help their personnel get trained in CPR.
Apart from the chest compressions in the cardiopulmonary resuscitation training program for rare rescuers, like the automated external defibrillators, what we hear, AEDs, are they installed, and what do you have? How are they installed in the United States of America?
They've started appearing in public places, I would say, in the last decade or so. There are more and more added every year. In my building, there's 2 units that are available for staff, and just like CPR, there's training for that, on how to use AEDs. Of course, training is extremely important. It's an electronic device. You need to know how to use it properly.
So, in other words, in the United States of America, and probably in other countries too, like being a government employee, as a layperson also, what you mean to say is the emergency care response within 4 to 5 minutes by sending the ambulance, but meanwhile bystanders are also trained in CPR, and automated defibrillators are also, external defibrillators are available in public places. Okay, that's excellent. The other thing is, Srikanth, have you come across, God forbid, any such instance of an out-of-hospital cardiac arrest, or in your vicinity or in your city?
I've had a couple of instances, but fortunately the people were wearing, the person was wearing a automated internal defibrillator. I was, in fact, my boss, I was playing tennis with him, and he had a cardiac arrest. He fell on the ground, and within a few minutes his internal defibrillator.
Probably his boss might be having a rhythm disturbance, and what you call as a auto-implantable cardiovascular defibrillator, AACD, which is done by the electrophysiologist. Probably he underwent that, and
he survived. Yeah,
that's excellent.
Excellent. So all of these things, I think the answer lies in many different places. It's getting people trained, having awareness in the general public, having AEDs in locations, and of course medical care that provides such tools. I think all of these.
The other idea is probably you are in a city, but what about the rural areas in the US? Does the medical emergency does it differ compared to, or is there any discrepancy between the rural and urban?
Absolutely. Like anywhere in the world, as you go away from the city centers, there's response rates increase. If you're in rural area, you could be an hour away from the hospital.
Okay.
Even getting a helicopter there, it's not uncommon to use helicopters for medical care there for emergency services.
Like suppose if someone is there in a rural area in US and there's a medical emergency, as an accident or a victim of a cardiac arrest, how does the system respond there?
It's very similar to what happens in a city, except that when you're in a rural area, your response times are much higher. And that's a risk. Again, in those situations, it's all the more critical that if anybody's, somebody's passing by, there's other people that are driving on the road, that somebody has knowledge of CPR, somebody's able to go in and help. And that happens a lot of times, when there's an accident on the road or something like that, or somebody has a cardiac arrest in a home someplace. Having somebody in the family, a neighbor or somebody else that can come in and help is really critical, because the response times are so large.
Do you have air ambulances there?
Yes, we do.
How frequently are they very systematic or?
They're automated again, depending on the nature of the emergencies. You know, if it's cardiac arrest, they're automatically triggered. They come in and help.
But so irrespective of the patient's status,
Correct.
the air ambulances are sent to the US.
And that's one of the things. Regardless of a person's ability to pay for medical services, all of the emergency services are provided to all of the population in the country equally.
Thank you, Srikanth. Srikanth is, as I told you, he's my classmate until 10th in St. Paul's School. He's an architect who works in the government side in the United States of America. He has been kind enough in giving a short interview. I explained to my friends about the nature of emergency care in the US, where someone has a cardiac arrest or a victim of an accident, the emergency care responds very fast. Within 4 to 5 minutes, the ambulance arrives on the scene and a bystander there does a cardiopulmonary resuscitation. They are trained in CPR. Even lay public are trained in CPR in the US by the employers of the organizations there. And automated external defibrillators, as I told, are installed in the public places, in the government organizations or private organizations. The other aspect is even in the rural areas, there is an availability of air ambulance. And what is very important is, irrespective of the victims' economic status, everyone, irrespective of anything, caste, creed, they are provided emergency care without any discrepancy, without any discrimination, and that's a very important thing. And hope under our national initiation of CPR education, what I have started, probably we hope that the emergency care, particularly lay rescue of CPR, the awareness on CPR, and installation of the automated external defibrillators in public places in all Indian states, particularly in our state, is likely to improve. And probably what is important in this program is to improve the survival rate of an emergency victim, whether it is a victim of cardiac arrest or a victim of an accident. Survival is the only thing which is very important, and we have to take it to a level where the survival of all these victims of cardiac arrest or accident victims is definitely improved. Thank you, Srikanth.
Thank you. If I may, Srinivas, I just want to say a couple of things. You know, I remember the days when we were growing up and going to school, there was hardly any awareness of CPR.
Yeah.
And you took up on this issue, and the efforts that you put in over the last 3 decades made a huge difference in our town, in our city. The big CPR event that you did last year really brought this to the front. And it has a multiplier effect. You know, it's one of those things, a skill that you teach one person and then it multiplies over a period of time. And I hope this is something that lives forward with your effort, with effort of all the medical establishment, but also beyond the medical field, where general public start owning it and improving their awareness of emergency care.
Thank you, Srikanth. Thank you.